Hi everybody, Dr. Debunk here, doing another video debunking medical myths, garbage, and crap spread by doctors and other health professionals. So if you haven't heard of me yet, I'm Dr. Debunk on YouTube and everywhere else. And that's what I do. I debunk the medical junk that's being thrown out there today. In the 39 years I've been a doctor, medicine is becoming so confusing and so corrupt and so messed up. That's what COVID showed us. So I'm doing all kinds of different videos, and this one's going to be on colds and flus. We're in the cold and flu season now, and people go to their doctors and get stupid antibiotics and all kinds of goofy stuff with colds and flus. But really, after 39 years, I can tell you what to do for a cold or a flu and how to do it best, because you really don't need to see your doctor for colds and flus because they're caused by viruses, and he can give you antibiotics which don't do anything. Now, there is one, the Zithromax or Z-Pax, that can help, but you really shouldn't be taking it for other reasons. So, the big deal with colds and flus is they're viruses. So let's do a little history here. So, a cold virus, the main group of cold viruses are called rhinoviruses. Now, there's 4 coronaviruses that cause colds too, but basically they're viruses that can give us a 3 to 5 day yuckiness in our sinuses, runny nose or pressure, congestion, a little sore throat. But what you can do for these is ignore them. And if it's not bad enough symptom-wise, you don't have to do anything. But what we're going to talk about is the 4 different medications, or 5, that can be beneficial to give you less symptoms while your body heals itself anyway. And that's the big thing you got to understand. The human body fixes itself in every possible way. We were made to fix ourselves. And doctors get all this credit for fixing you with the drugs they give you, but the drugs just maybe give you relief. And your body fixes itself, and then we take the credit. But really, you don't need to do anything. It's just how unpleasant, how uncomfortable are your symptoms? Can you live with it and they'll function? So colds and flus, if they're cold, if they're mild, you just ignore it. And we'll get to if you need to treat it. Now, flus are different. Flu virus is influenza. There's theoretically about 145 strains, and some are stronger than others. Your unique ability to resist one variant or strain over another determines how sick you get. But flus will last typically 5 to 7 days, 5 to 10 days, sometimes 2 weeks in a bad flu season. And we have those. In 2016 was a really bad flu season. That's, if you remember, everybody was sick for 2 weeks, ton of work days, schools almost had to shut down. There was teachers out so much that, anyway. But then other years it's very mild. We'll see what this year does. But a flu virus can make your life a lot more miserable. When it's a bad flu, you'll have a couple days in the middle. You feel like somebody ran you over, and you stay at home for a day or two. So they're not serious. Now, I am referring in this video, as most of my videos, to people that are not broken with disease. You know, if you have upper respiratory problems, you have emphysema, and you're pushing an oxygen tank, then you have to take a flu more seriously. But healthy people at any age should basically ignore colds and flus and then do symptomatic treatment. As you've all heard from me, and if you haven't, I don't like doctors using drugs to fix people's medical problems when they're not a disease-based problem. If you get high blood pressure, diabetes, or cholesterol, and nerve disorders, and headaches, and all these other things, you shouldn't be using drugs to fix those problems. You change your lifestyle. And that's what will be happening with Dr. Debunk over the next 2 years as I populate all the natural treatments I've learned for 29 years about how to get off drugs and only use them intermittently for relief. And that's what we're talking about here. The correct use of drugs intermittently. So if you have a bad flu, there's 4 drugs you can go on that can give you relief. And then as soon as you're done with the flu, you'll be off them anyway. So why not? You might even not miss work. And so treating a cold or flu is based on the intensity of your symptoms. So most people start out with the sinuses, your nose or sinuses. You either have a lot of congestion or you're draining or both. And so the first over-the-counter drug that's really beneficial to use here is one of the allergy D medicines. And I don't care which one you use, Allegra D, Zyrtec D, Claritin D, those three. There's other ones that are same, but they're basically pseudoephedrine, that's the D part, and some type of non-drowsy antihistamine. And so those two in combination dry up a runny nose and relieve the pressure. And that's the starting point always. Don't use liquid preps or junk. If you do liquid cough and cold, you're a sucker because you're just drinking sugar or a bunch of fake sugar, and it'll do nothing. The amount of medication in a liquid cough and cold product is enough for a hamster. Are you bigger than a hamster? You're wasting your money. Now, so that's the starting point. And if it doesn't give you enough relief, and again, I don't care which one you take, then the generics, they have those. These are all over the counter, not prescription. And of course, if you have a bunch of medical problems, you'd have to make sure you're okay with your doctor beforehand, because this is over the counter treatment. And this is educational. Everything I'm telling you here is what I do with my patients, but it's between you and your doctor if you're going to actually do it. That's a little disclaimer that I have to say. Anyway, if it's not satisfactory or you're really getting hammered from day one, the second drug you add is the nasal steroids. Flonase, Nasacort, Rhinocort, there's another one. I like Nasacort because what's in there is something called triamcinolone, and I think it's the best upper respiratory steroid. Now, the nice thing about this is steroids are great to reduce inflammation, but if you take too much of them, it's going to eat your body alive, especially shots or pills. But delivering it nasally, you get the main effects here, all through your sinuses, a little back of the throat. And so if you have a lot of sinus pressure and it just feels so inflamed, you just want to rip your nose off, then you do the nasal inhaled steroids. Now, I think a lot of them say 1 puff twice a day. Now, I can't recommend this to you, but what I do with my patients, virtually every one of them, is I tell them 2 puffs 3 times a day. And they do fine. It has never hurt any patient of mine ever in 15 years I've been doing it. But I can't recommend that to you because you're supposed to do what the manufacturer says. But you can talk to your doctor about it, and most doctors would say they don't care. Because the steroids stay locally, not much gets in your system. And so the allergy D medicines and the nasal steroid is just the best. That gives you the most relief for your money and effort. And that's what we're talking about, getting relief. Now, if you have a cold, you don't have the aches and pains. But if you have a flu, it can be very achy, sore, because there's a lot more inflammation from a flu virus than from a cold virus. So that's where you add Advil or Aleve. Now, I don't normally care about generics. Just know they're weaker and you have to take more. But ibuprofen and naproxen are some of the most common drugs made worldwide. And I wouldn't take a Chinese drug if you force me to, because the Chinese drugs are the junkiest. There's probably dead Chinamen ground up and throw in there. Who knows what they put in there? The Chinese government is interested in production, and they expect their workers and people to produce. They don't care what they do to their product at all. You can validate that in many ways all over the place. So I'm not going to put anything I know comes from China in my mouth, period. It's bad enough in the US now. But that's where I say name brand, Advil or Aleve, you should try them both. They're non-steroidal anti-inflammatories. They really help the achiness, but again, you have to dose up. Sorry. The prescription doses are, 400, 600, and 800 milligrams of Advil. And again, I can't tell you to do it, but that's what I have my patients do, depending on body weight. You can take a lot. I mean, people take 2,000 milligrams a day of ibuprofen, and it's nothing. If you take too much at any moment in time, your stomach will bug you. But you could have 2 bites of food, literally, and take ibuprofen. And some people like naproxen or Aleve versus ibuprofen or Advil. It's up to you. But again, you have to make sure your doctor's okay with you taking more than the over-the-counter recommended dose. But it really helps the achiness, So that's the third medication. And then I said 4, but there's really 5. The fourth one to add is a mucolytic, and the most famous one is Mucinex. Mucinex is a really old medication. It's guaiacocin. And what it does is it kind of liquefies or softens up your phlegm and boogers and junk. And it works okay, but you just get the plain because they have like Mucinex D or guaiacocin D, but the D is just the pseudoephedrine, which you're already getting. And you don't want to double dose Sudafed or pseudoephedrine because you'll feel like you drank a pot of coffee and so only one product. And so plain guaiacocin helps that. And then the final medication, and again, the amounts you take and the frequencies based on how yucky you're feeling, would be some kind of cough suppressant. They have a couple of those out there, and they work a little. Right now, because of our psycho government, the FDA has lost their minds. They are utterly useless organization for the American people. See how much I like them? And so they are restricting the production of Phenergan and codeine. Phenergan and codeine cough syrup is just the best stuff out there. But they don't want people to take it. Like, nobody gets addicted to codeine, especially codeine cough syrup. That's idiotic. I'm sure they probably say, well, we have evidence that people are getting addicted to it. And then if you pulled off their fingernails to tell the truth, they would say, yeah, we had one case report 2 years ago of somebody getting addicted to phenergan with codeine. And that would be their evidence that it's madness. They're useless. The FDA, the NIH, the government organizations. Anyway, their recommendations obviously to me are meaningless. So, but some areas can get it if you're really coughing bad, phenergan with codeine. But they have another prescription medicine, benzenate, not so good. But the over-the-counter stuff can help a little. But the main cause of cough, continuing that, for most people with upper respiratory infections is the drainage, the secretions dripping down the back of your throat. And so that's where the allergy D, Allegra D, Zyrtec D, Claritin D, they work the best to dry that up. But you got to get the D form. And you can get them separately. You can get pseudoephedrine 12 hours separately and plain antihistamine separately. And I don't care how you do it. But those 5 medications used correctly are completely safe. And when you're done, you're going to be off them. And so that is what you need to do. Now, how do you know when you need antibiotics? Your symptoms are changing. So viruses give you weaker symptoms than bacteria, which antibiotics work against. So you have clear, watery discharge, maybe yellow a little. That's a virus. When it's green and thick and gooey, that's a bacteria. Viruses might give you a fever of 99 to 100, and then younger people can even get 101. But then bacteria, strep throat, sinus infections, then your temperature can get higher. Even at my age, or what people over 50 can still get 101 or so. That, if you're over 50 and you get 101, 102, you probably need antibiotics. But that's up to your doctor. Have doctors develop different beliefs about when to use antibiotics, And so a lot of green stuff, fevers, noticeably different coughing, more frequent, more aggressive, phlegm. Typical viral infections, you don't really get phlegm. Even when you have viral bronchitis or viral pneumonia, you're not going to produce phlegm. So lots of phlegm, colored fevers. And then you notice you're much worse than normal when you've had a cold or a mild flu. And then you have to see your doctor. So as a reminder, antibiotics don't work for any viruses. They're specific antiviral medicines, and they're class related, so you can't just take, we have broad spectrum antibiotics. We have broad spectrum antivirals, but they're the newer ones that we used in COVID effectively, ivermectin, quinine. And so, but those you never use those for cold and flu. Since I'm on it, many of you know about the effectiveness of ivermectin and quinine. Ivermectin was the best. but you don't use those for non-serious infections. I'll be doing videos in the future to tell you how to use those when the next pandemic hits, which it's going to hit. It's just a matter of when. We'll talk about that. Anyway, but for now, I'm a little over my time here. I don't like to keep moving on this. So if you get the more serious stuff, then you see your doctor and get antibiotics. But you should not want to take antibiotics for viruses. I know you feel crappy, but the medicines I laid out will give you relief. You know, your body has to get rid of the virus. Antibiotics just screw up your intestinal tract. We are seeing catastrophic long-term consequences of excessive antibiotic use, like heart attacks and stroke, because your germ flora gets screwed up for 20 years from all the antibiotics. The bad germs that repopulate from antibiotic use cause all these inflammatory reactions that are causing your arteries to clog, and your incidence of heart attack and stroke, especially women after menopausal years and men after 60, it's measurable. It's a huge thing now they're looking at. So if you do, final thing, if you do have to take antibiotics, always go on probiotics and try to repopulate the healthy germs. So that's it for this. The final thing is, I'm doing part 2 of this. Well, actually, I already did it and it's up. Part 1 got destroyed and eaten by YouTube. Anyway, it's a long story. And so part 2, which you can already may have seen, is about the natural treatment using natural germicides, and the main one is KSK. And I'll talk all about that then. So that's it. I'm Dr. Debunk, debunking medical myths, garbage, and crap spread by doctors and other health professionals. Thanks for watching.